Hi there, folks. Good morning, good afternoon, good evening, and good night. Thank you all for joining the G6PD Operational Research Community of Practice two-part webinar series. Tonight and then again tomorrow night, we will be discussing training workshop learnings and user perspectives from G6PD testing activities in Bangladesh. Tonight, our conversation will be moderated by Rosalind Howells, as well as Shafiul Alam as our speaker, and we'll let them provide their introductions momentarily. Before we move into today's presentation, I just wanted to provide a brief agenda in regard to today's conversation, where I'll give you a few logistics as well as speak a little bit to the GORCOP, and then we'll begin our presentation. So for those who may be new to the GORCOP, I just wanted to highlight that we do have a program page for the community of practice at path.org/GORCOP. And that gives you details as to what the community of practice is. In short, it's a collaboration of researchers, organizations, malaria control programs, and clinicians committed to advancing the introduction and scale up of G6PD diagnostics in support of safe access to radical cure treatment for P-Vivax malaria through operations research. And so to support information sharing, the GORCOP maintains a digital central repository of resources that is accessible to all participants and members of the GORCOP, which is short for the G6PD Operational Research Community of Practice. And the GORCOP also hosts meetings and webinars like this, provides ongoing updates in the field, as well as creates connections among participants. And so please feel free to access that website at any point tonight and after the webinar, as well as follow up with any questions you may have. And so without further ado, I'm going to go ahead and move into the presentation for tonight. There will be opportunity for Q&A at the end of the presentation, where you can simply raise your hand in the chat function, where Roz may be able to call on you and facilitate your question. And you may also submit your question directly via the chat. And so we'll be monitoring that as well. And so, all right, I'll pass it to you, Roz, if you want to take it from here.
Thanks, Hunter. Yeah, good evening, morning, hello. My name is Rosalind Howells. I'm based with Find. And I just wanted to start off before introducing today's speaker by taking the opportunity to thank the PATH team, Emily and Celia and Amanda and Hunter and Gonzalo, for everything you do, having set up and now running this community of practice. I always find that the wide-ranging seminars that you organize are really interesting and useful, and likewise the discussions afterwards, and the check-ins with fellow G6PD colleagues from across the world every couple of months is a motivating reminder that we're all part of a bigger team, sharing our experiences and working towards a common goal. So thank you for what you do for this and staying up so late tonight. So as Hunter mentioned, and as you'll have seen from the invitation to the seminar, this is the first of two sessions discussing experiences with quantitative G6PD diagnostics in Bangladesh. So today we will hear about a training workshop with the SD Biosensor Standard test. And then next week, so next Thursday, colleagues from the University of Maastricht, Nora Engel and Christian Gergu, who are social scientists, will present their findings on perceptions around the ease of using the test, and then also the broader feasibility of bringing it into routine care in Bangladesh. And these studies were conducted in collaboration with colleagues at Menzies as well, and us here at Find. Right, I'm going to introduce today's speaker. So Shafiul is an associate scientist at the Emerging Infections and Parasitology Laboratory of icddr. He received his PhD and master's degrees in parasitology from the University of Dhaka, Bangladesh. His postdoctoral training was then at the Griffin Institute for Drug Discovery in Australia through the FIT2 fellowship program. He also received training on point-of-care diagnosis from the University of Tokyo, the Fondation Mérieux, PATH, the University of Washington, and the University of Vermont. His research interests include point-of-care diagnostics for infectious diseases, G6PD deficiency, host-parasite interactions, and vector control. Recently, he's also been focusing on anti-malarial drug resistance, particularly artemisinin resistance spreading throughout the Southeast Asian region. Shafiul has also been central to advancing the G6PD research agenda in Bangladesh, and he's going to share some of his experiences with us now. Shafiul, it's a real pleasure having you presenting today. Over to you.
Thank you, Ross. Thank you, everyone. My name is Shafiul Alam. I'll be presenting a training workshop for the health service providers to support the implementation of the SD Biosensor Standard G6PD test in health facilities in Bangladesh. Next slide, please. So before I go to the main presentation, I'll discuss some backgrounds from where I am actually. So I'm from International Center for Diarrheal Disease Research, Bangladesh, commonly known as icddr. Our institute established in 1960 as a cholera research laboratory. And in 1978, it gained its current formation through an ordinance from government of Bangladesh. The institute is governed by 17 board of trustees and has a mix of national and international staffs, including public health scientists, laboratory scientists, clinicians, social scientists, and experts in emerging, re-emerging infectious diseases and vaccine sciences. Next slide, please. So ICDB started working on malaria from 2003. Currently, we have a cohort of 20,000 population in Bandarban district, which is the most malaria endemic district area in Bangladesh, belonging to 7 ethnic groups, and we are maintaining this site since 2009. And we have dedicated labs in Dhaka and field site, and we have trained staff such as qualified doctors, medical technologists, and field workers. Next slide, please. So during past 10 years, ICDB malaria team was involved in several research activities on G6PD. We have a cohort of 1,900 people for non-G6PD levels in Bandarban. We are certified for independent performance evaluations of diagnostics and reference assets for G6PD deficiency through PATH external QC/QA program. And we are also the reference center for WHO in vitro pre-qualification for G6PD point of care test. And so far we have evaluated one product, and hopefully in coming days we'll do another one. Next slide, please. Next slide, please. So here you see the banners of our workshops. So the training itself was named as Study the Implementation of the G6PD Biosensor in Bangladesh. Next slide, please. So all you know, the quantitative G6PD testing is needed for Plasmodium vivax radical cure, whether it's a 7-day high-dose permethrin regimen or a single dose of tefenoquine, to protect patients with G6PD deficiency or intermediate levels. To make such radical cure widely available, tests should be compatible with point-of-care settings. Next slide, please. So handheld quantitative G6PD tests developed by SD Biosensor and PATH, the standard G6PD test could be is a good device, but tests not yet widely used and limited evidence on the feasibility of implementing it in routine practice. Next slide, please. So our objectives were to evaluate a set of training materials on G6PD biosensor, assess participants' proficiency with the test after a half-day training, collect their opinions on the training process and materials to evaluate participants' experience with using the G6PD biosensors, their opinions of the ease of using the assay, their perceptions of the feasibility of implementing it in routine care in their work settings. So our main focus on the diagnostic itself, not on the broad concept of policy making and management. Next slide, please. So the two workshops were conducted at ICDB field station in Chakoria, which is 350 kilometers away from Dhaka and located in Cox's Bazar district. Training itself were conducted in 9 and 10 October 2019. Next slide, please. So participants were actually invited and selected and invited by National Malaria Elimination Program of Bangladesh. 29th medical technologies from sub-districts health facilities and districts hospitals. 6 technical experts from central level were participated. The facilitators were from icddr lab experts and our medical doctors, study investigators from Menzies, Fine, and University of Maastricht. Next slide, please. So medical technologies play an important role in our health systems. They do multiple tasks, like they do phlebotomy, and they do all kinds of lab testing, including malaria microscopy. They have a diploma on medical technology, so it's a 3 years diploma. Some of them has also have bachelor degree, and they would be the first target if biosensor is deployed. So more 2/3 of them had 10 years of professional experience, and 50% of them had previous experience of in research studies. 50% of them had prior experience using a glucometer or HemoQ, this kind of point of care test, and only 2 of them had some kind of experience of using biosensor. Next slide, please. I mentioned that we had 29 technicians, medical technologists from endemic areas. So basically, they are selected from 4 endemic districts: Bandhavgarh, Rangamati, Khagrachari, and Cox's Bazar. If you look to the 2019's malaria data that I collected from NMEP, like 95% of our total cases were reported from Bandhavgarh, Rangamati, and Khagrachari, collectively known as Chittagong Hill Tracts districts, and Cox's Bazar contributed 4%. In total, like 99% of our cases actually came from these 4 districts. So other 9 districts only contributed only 1% of our malaria burden. Next slide, please. So the training sessions had we had a schedule for 3 hours theoretical and practical training, then 2 hours assessments and feedback, and we repeated this in 2 days, and we had like 17 to 18 participants per workshop. Next slide, please. In the theoretical training, we use different teaching formats like slides on key points such as PV radical cure and G6PD deficiency, Bangladesh eliminations effort and G6PD situation, G6PD testing options, and practical step-by-step demo of the IFU and path videos. The mix of formats were well received by the participants. Sessions were very interactive. Given that the target audience of this training who were familiar with lab testing, we included detail on PV labs and G6PD deficiencies, but that wouldn't be appropriate in all settings. Next slide, please. So as I mentioned that we went through the step-by-step of the IFU, and also we using our local cutoff in these sessions. Like at that time we are ongoing a clinical trial, and we use the cutoff for normal, intermediate, deficiency that we are using for that study. Next slide, please. In the practical training, demo given by lab expert to groups of 5 to 6 participants. Each participant then practiced using the assay with guidance from the lab experts, and we allowed 15 to 20 minutes per participants with the test. Ideally, each participant can practice 2 tests in this time, and the practical session took time. And it's very important to doing in small groups so that they can interact with the trainers, and also they can interact and talk by, they can also help each other too. Next slide, please. So after that, participants were then observed performing the tests. So trainers completed an assessment yes/no format on each steps. Next slide, please. Here in the about the practical proficiency assessments. So green cell indicates that the steps was correctly carried out. Orange cell that it was not. Each column represents one participant. Percentage down the right side indicate that the proportion of participants who correctly perform each stages. Here you can see that for the sample collections and day on wipes first drop of blood, most of the participants they couldn't perform properly. So in day two, we gave emphasis on that point, and that's why they improve on that point. Otherwise, the assay procedure and results, the overall good proficiency was observed. However, this was done only a couple of hours after the practical demonstration. May not be indicative of long-term performance. Next slide, please. So 11 computation result interpretations. Questionnaire completed out after practical assessment developed by PATH. So first section we had the 1 to 13 on the product level and test instructions for use, and second sections question 12 to 20 on interpreting the biosensor results. Next slide, please. So overall results to part 1 were 93% correct and part 2 were 94% correct. The result of these tests indicate that on the whole, participants had a good grasp of the main concept of the standard G6PD test, and that results were being correctly interpreted, with only 14% of the participants scoring less than 90%. And we also noticed that the technician focused on G6PD results without always noticing if hemoglobin was between 4 and 7 grams per deciliter. For example, the automatic warning only shows if hemoglobin level is less than 4. Next slide, please. Focus group discussion. The end users feedback led by social scientists from Maastricht University. Christian was there at that time, and our icddr staffs led by Matin. And methods and result will be fully discussed by Nora and Christian in next webinar. So I also invite you to attend that webinar too. Next slide, please. Lesson learned. Importance of allowing sufficient time for each activity, especially the practical training and assessment. Need to train more broadly on clinical decisions made from the test results, and also confidentiality of test results in a group training, ensure privacy, like when we're testing in 5 to 6 people. So if someone is deficient or intermediate, so there is the issue of privacy there. Next slide, please. So the main practical difficulty was, is the easy to use. So perhaps the IFU should explain more about on this. And one suggestion came out like, to include more spare, devices in the kit. Difficulties with blood volume if users were not well experienced with finger pricking. And main weakness I mentioned that also came out in the theoretical assessment, that incorrect answering when hemoglobin is less than 7 grams per deciliters. Where most of the respondents didn't notice that hemoglobin was less than 7 grams per deciliter, and hence that the G6PD level should not be interpreted without any hemoglobin confirmatory tests. The current SD Biosensor guidelines leave a gap here. It is stated that G6PD results should not be used if hemoglobin is less than 7 grams per deciliter, but the error message only appears if hemoglobin is less than 4. We would recommend that the setting be altered to promote clear interpretations. Example, by raising the thresholds for not available result, or adding a clear warning signal when hemoglobin is between 4 to 7 grams per deciliter. Next slide, please. So consideration for additional research needs, variability when participants were tested twice, perhaps need more evidence or inter-laboratory, inter-operator, or inter-experiment variability study. At present, icddr, Menzies, and FIND are working together for a reproducibility study. Setting threshold for normal intermittent deficiency, feasibility to identify universal thresholds or pre-program the biosensor in each setting to display high, medium, or low to increase its ease of use, perhaps. Next slide, please. In conclusion, the biosensor and the workshop itself were well received by the participant. The test being performed accurately and perceived by the intended end user as feasible to implement for Plasmodium vivax patients management at the peripheral level. Lessons learned from the workshops can help support to development of materials of future training tools for end user community. Next slide, please. Moving forward with implementations, the broader case management context, including patient counseling and case management decision informed by the diagnostic result, will also need to be considered. The targeted audience for training workshop at that implementation set will have to include program management staffs and medical staff, as well as the laboratory technicians. Next slide, please. So we are grateful to the workshop participants for their time, and I am also grateful to our team, Kipriya, Sharif, Mateen, Dr. Ching, Nusrat, Jennifer, and Dr. Wasif Ali Khan, who actually started the Bandarban field site in back to 2009. And we are also grateful to our National Malaria Elimination Program, Professor Sania Tahmina, Dr. Akhtaruzaman, and Anjan, and also grateful to our research collaborator from FIND, Ross, Sandra, from Maastricht, Christian and Nora, and from Menzies, Ben, and Kamala and Rick Price, who are actually supporting our research over the years. Next slide, please. Thank you everyone for your patience hearing. And this is the photographs we took after day one training, and I'll be happy to answer your questions. Thank you.
Great, thank you very much, Shafiul. Great presentation. Does anyone have any questions? If you do, you can either raise your hand and then we can go over and you can ask your question, or you can also type a question into the chat box. Okay, Shafiul, can you see Ari's question?
Let me see.
So Ari says, have the participants been exposed to G6PD testing before?
No. Because there are, like, out of 35 participants, there are only 2 of them had some kind of training with or exposure with the biosensor. Usually the GCP test is not being done routinely in our country. So I guess none of them actually exposed before.
Okay, thank you. I think Evelyn has a question now. We can't hear you yet. It looks like you're muted.
Can you hear me?
Ah, yes, now we can. Thank you.
Yeah, sorry everyone. Thanks Shafiul for the presentation. I have two questions. One, when you had the test for doing the steps of the G6PD testing, did they have a job aid that they could refer to at the same time? And was that part of the process that they should be looking at the job aid while they perform the steps, or was that not included? And the second question was, were there any participants where you did actually see less than seven hemoglobin? And if so, what is the confirmatory test? Because we are trying to do something similar and we're not sure whether there needs to be another device also at the health facility to do this confirmatory test. Thank you.
So I answered your first question. So we haven't seen anyone has hemoglobin less than 7 in our training workshop. But for confirmatory, like in field, we had available, like HemoQ was available. And in normally in our health facilities, in sub-district level, we have auto-analyzer. They can we can refer to that, like go for full complementary blood count. So that is available. And actually, I missed your first question. Can you please repeat again that your first question was what?
Yes, the first question was when the participants did the G6PD test, where you then scored whether they did the right step or not, did they have a job aid
Yes.
to refer to? Yeah.
Yeah, we scored like that whether they're, because you saw in there, in every steps the trainer you mark whether they're doing yes or no format.
Okay,
Yes.
thank you.
Wasif, I think you had a question. Would you like to go next?
Yeah. Hi. Thank you, Ross and Shafiul for nice. Actually, not a comment, since I actually attended that workshop. So just my observation, because one of the points that was earlier said that about whether they have any experience. Definitely, the majority, almost as Shafiul said, just 2 persons had some experience. But I really observed that these lab people are there. There is really lack of staff, so it's a really burden for them. And there are people who could pick up, but things they were saying that since already they are overburdened with there's so many things, and this was top of that. But I don't know. I think this is generalized in every developing countries. But this is something we have to think over. That the less the steps, but there are a lot of steps in this work. So and they have other things to do. So I don't know how we can address this. This is just an observation what I found. I just thought that I should discuss at this point, since it's a big gathering here. You can think over.
Yeah, thanks for this comment. I think when Nora will have some, those information like the feedback from the participants, and probably we'll have more discussion and next webinar, I guess.
Yeah. Ben, you had a question. Would you like me to read it, or why don't you ask it yourself? Okay, so Ben had a question. Shafiul.
Yeah, I saw that. Yeah.
Okay.
So the Ben's question was about the HemoQ, that whether how often they use and retrain. So so HemoQ is not is a part of our government's system. So as you see that 50% of our participants, they have some exposure on training and research activities. So they have training on HemoQ and using the HemoQ during that time, but not as regular basis. Maybe a glucometer they use in regular basis because they also do some private practice after the working hours. But for HemoQ, it's other than research activities, this probably don't use it.
Okay, thanks. Jemana was also wondering
Yes.
about using the controls in the training, and how did we find that?
Controls, we had slides on controls, and we explained the control, but probably the controls were not handed over to the participants. And training materials, no, it was in English, probably, maybe in future, if we do that training course again, so we'll translate to Bangla. But at that time, only that all the materials were in English because we have the international faculties. But we had interpreter, like if they had any questions, so because they're very much interactive sessions, so we had interpreter there to help them.
Yeah, and just to add to that, the presentations were all led by Kibriya in Bengali, so the discussion was all held in Bengali. Yeah. I also wanted to just add that the controls were used as part of the training session. So given that they're an integral part of the test, so that they were included in the demonstrations, but then the practical session afterwards was not with the controls. Yeah. Yeah, and Nora's confirmed then that she will be, in her presentation next week, she will be discussing issues like workload and concerns that the technicians had about how the test could be introduced on top of everything else that they're doing. So yeah, we'll have more discussion on that next week. Shafiul, I'm not sure you answered this particular bit of the question. Ben was asking specifically about the retraining with the HemoQ, and
Yeah.
do you think there are lessons that can be learned from that in terms of how, because one of the things you mentioned was that the assessment here was done kind of on the same day as the training.
So to my knowledge, the HemoQ, this is not a part of our regular health system. As you remember, that 50% of our participants, are exposure of working in other research studies. So at that time, they use mostly HemoQ. So I guess they don't have regular retraining on that. So only even when the research activity is ongoing. So it's not a regular and not a regular practice. So maybe only for the research activities that you.
And in terms of retraining needs with the standard tests, do you think, like, is there a structure in place whereby technicians are brought together every 6 months for other trainings, and then a refresher training could be added onto this, do you think?
Yes.
Or would it have to be an independent?
No, we can, the main issue is like whether if our NMEP is going to introduce any kind of G6PD point of care tests in future or not. So if they don't plan to use this, so if if they want to introduce this in our health system, so definitely there should be some kind of system we have to implement there. Like for when we introduced malaria RTT in our national program, so there was the a number of training and refreshers training. So that will happen. Like usually they have yearly one refreshers training for the malaria treatment guideline. So we'll be have the similar. We have like annually there should be one refreshers training. But the important question is whether Bangladesh is going to implement this point of care test for G6PD in the endemic areas or not.
Okay, thank you. So Gonzalo has just posted a comment. He says, "Thank you for the great presentation. I have two questions, so I'll ask them separately. Number one, was this group already sensitized to G6PD deficiency? And two, depending on the answer, how did this impact the outcomes of the training?" So did
in the training sessions that they have given, informations on the G6PD deficiencies, and they are some kind of sensitized. Yeah.
Did they know much about G6PD before the training session?
Not really, because they don't see much deficient patients in our health system. That's what you had, like a few years back. We had Ben and together Ben, we had a study, and we investigated and we interviewed like a number of physicians in the endemic areas, and at that time they said that they don't see much patients on deficiency. Recently, we reported one such patient like with in Bandarban, but they are not actually aware about this and before this training, so they probably know a little bit, but not a great deal of that.
Okay, thanks. And so in terms of how that impacted on the outcomes of the training, I think what we saw in the, so, I mean, given the results of the assessments and the questionnaires that were done, it seems like the background that was given as part of the workshop was sufficient to help them understand and why the test was being conducted and what the results are indicating. Would you agree?
Yeah.
Okay, thanks.
And Ben has some question, I see.
Yes, Ben says, do you think the biosensor would be integrated into routine care in Bangladesh in the absence of a standardized cutoff, or do you believe that this would be a requirement for implementation?
It's really difficult to have the absence of a standard cutoff. And Nora's team did a lot of studies, not only these workshops, and they also interviewed some policymakers about this. And I leave up this to Nora to discuss more. But practically, what is we hear from the programs, like it depends basically on WHO. So if WHO recommend to use biosensor or any kind of point of care test for G6PD testing, definitely program will consider. And definitely we should have a cutoff is an issue. Perhaps for Bangladesh, we can use the local cutoff as we have some baseline data. But maybe universal cutoff at this level, maybe it's difficult to set.
Yeah, tricky issue all that. And so yeah, just to reiterate what Shafiul was saying during his presentation, for the study we used the cutoffs that were being used in the clinical trial that was being conducted in parallel with the training, so as to avoid any confusion with different thresholds being used. Even though obviously the SD Biosensor IFU comes with recommended thresholds as well. Ari, you still have your hand up. Do you have a further question that you'd like to ask, or is that from earlier? It's from earlier. Okay, thank you for confirming. Gonzalo, did you want to say something? I'll hand over to you.
Yes, just to clarify, I think you just raised it. The IFU thresholds on the SD biosensor are, to the extent that we've seen data from multiple countries, are very robust, universal thresholds. So in the absence of any other data, I would recommend sticking to those, because there is, you know, it's not the ideal data package, but there is quite a bit of data behind supporting those thresholds. Yeah, just wanted to clarify that. It's a separate discussion, but I just wanted to clarify.
Okay, thanks, Gonzalo. Yeah. But yeah, so here it was just to ensure consistency with the trial. That was why they were slightly different. Okay, do we have any final questions, or we can wrap this up and then pick up again next week with Nora and Christian? Okay, Hunter, I think back to you. Thank you, everyone. Thank you,
so much,
Shafiul.
Ross. Yes, thank you both. That was excellent.
Thank you.
I just want to give everybody one last reminder that next week, same time, we'll be having a conversation with Nora and Sandra on user perspectives on quantitative G6PD test to support radical cure PVIVAX in Bangladesh. We're continuing this conversation. If you have any questions, please reach out to gorkop@path.org, as well as visit us on our website at path.org/gorkop. Thank you all for attending tonight. I hope you have a great day.
Thank you.
Thank you very much. Thanks, everyone.
Yeah. Bye. Bye.